Hello guys and welcome back to my channel. In this video we will be discussing about the anatomy of Orbicularis oculi. Orbicularis oculi is a paired, flat and a broad-based muscle that surrounds the circumference of each orbit and the adjacent periorbital region. Together with the corrugator supercilii and the levator palpebrae superioris, it is a part of the orbital group of muscles. Well, the orbicularis oculi consists of three parts. That is, the orbital part, which encircles the orbit. It has a palpebral part, which is present on the upper and the lower eyelid, and we also have a lacrimal part, which is a deep part, and it is attached to the lacrimal crest. The muscle extends between the three bones of the skull, that is the frontal and lacrimal and the maxilla, and also the soft tissue structures of the periorbital region. Before we move on to understand the origin, insertion and function of each part of the muscle, let us understand or know these two important ligaments that are denoted by this red squared boxes, that is the medial and lateral palpebral ligaments. Now these are the two important ligaments where the origin and insertion of Orbicularis oculi takes place. Well, to start with, the first part of Orbicularis oculi is the orbital part. Well, the orbital part overlays the orbital rim, that is, it encircles the entire orbit, and it originates from the nasal part of the frontal bone, apart from the maxilla, and majorly from the medial palpebral ligament. Now, the fibers encircle the orbit completely, extending into the soft tissues of the adjacent region and ending into the medial palpebral ligament, that is the site of origin. Well, the point to note here is that the orbital part has a bony origin, that is from the nasal part of the frontal bone, the maxilla, and also a ligamentary origin, that is the medial palpebral ligament. However, the orbital part has no bony insertion, but it instead attaches to various soft tissue structures of the periorbital region. For example, the upper fibers merge with the occipitofrontalis and the corrugator supercilii. The lower or the inferior or the medial fibers of the orbital part blend with the levator labii superioris or the levator nasolabialis. And some of the peripheral fibers can even stretch and are loosely inserted into the epicranial aponeurosis. So just like the corrugator supercilii, the orbital part of Orbicularis oculi has a bony origin but has no bony insertion. But it has an insertion into the adjacent soft tissues and back to its point of origin, that is medial palpebral ligament. Because of which Orbicularis oculi is considered the sphincter of the eyelids, involved in facial expressions, also in ocular protection and reflexes. The contraction of the orbital part draws the skin of the forehead and the cheek towards the nose. This protective function can partially or completely close the eyes, limiting exposure to potentially damaging factors such as bright light or blowing dust. That is, it tightly closes the eyes. Moving on to the next part, that is the palpebral part. Well, the palpebral part originates from the superficial surfaces of the medial palpebral ligament, as you can see from the blue arrow, and then they travel laterally along the eyelids to the lateral commissure of the eye, and here the superior and inferior fibers unite and insert into the lateral palpebral ligament. Unlike the orbital part, it does not encircle the entire orbit, but it originates from the medial palpebral ligament and ends into the lateral palpebral ligament. The contraction of the palpebral parts results in a finer control of the eyelids. Now, these muscle fibers pull the upper eyelid down and they raise the lower ones, thereby isolated voluntarily contraction of the palpebral part just gently closes the eyelids, for example when blinking or sleeping. Unlike the forceful closure or the protective closure which occurs in the orbital part of the orbicularis oculi. Now, the palpebral part can also involuntarily close the eyelids as a reflex mechanism. Now, this protective action wipes the tears produced by the lacrimal glands across the surface of the eyeball in order to keep it moist and free of potentially irritating particles. The fine control of the eyelids performed by the palpebral part also facilitates nonverbal communication and expression. Let us move on to the third part, that is the lacrimal part. Now, lacrimal part is also called as the deep palpebral part. It originates from the lacrimal crest that of the lacrimal bone, as you can see from the picture, and it attaches or inserts into the lateral palpebral ligament. The contraction of lateral palpebral part pulls the eyelid and the lacrimal papillae and hence dilates the lacrimal sac. Now, these actions work together, facilitate tear drainage across the cornea, and this part is also involved in compressing the lacrimal gland and ducts and further improving tear flow. So, basically, let us revise about the three parts. So, the orbicularis oculi has three parts, that is the orbital part, the palpebral part, and the lacrimal part. The orbital part basically encircles the entire orbit. It originates as a bony insertion from the nasal part of frontal bone apart from maxilla and also from the medial palpebral ligament. It encircles the entire orbit to end into the point of origin, that is the medial palpebral ligament. However, it does not have any bony insertions and it inserts into the adjacent surrounding tissues, and because of this non-bony insertions it functions as a sphincter, that it closes the eye forcefully and hence acts as a protection in when there is sunlight or when there is rain. The next part is the palpebral part. The palpebral part basically starts from the medial palpebral ligament and ends into the lateral palpebral ligament. So it has the upper and the lower palpebral part, which basically are present on the upper and the lower eyelids respectively. The palpebral part does not encircle the entire orbit like that of the orbital part, and the function of palpebral part is to basically gently close the eyelids and just like when you're sleeping or blinking, and it also helps facilitate distribute the uh, tears all over the cornea and keep the eyes moist. We also have a lacrimal part. The lacrimal part basically dilates the lacrimal sac and it helps in drainage of the tears. Let's move on to the nerve supply of the orbicularis oculi. Just like all the muscles of facial expression, orbicularis oculi is supplied by the facial nerve, and that is the zygomatic and temporal branches of facial nerve. The arterial supply of the orbicularis oculi is almost very similar to that of corrugator supercilii. It is supplied by three branches of external carotid artery, that is the maxillary artery, the superficial temporal artery, and facial arteries, but also apart from the supraorbital artery, which is a part of ophthalmic artery and which is in turn a part of the internal carotid artery. Well, this was about the anatomy of orbicularis oculi. To understand a little bit about the applied anatomy of orbicularis oculi, is that now when there is an injury to facial nerve, I will not go into the details of injury, whether it is supranuclear or infranuclear. I will just mention in briefly. Now, when there is an injury to facial nerve, it mostly results into a condition called as the Bell's palsy. Now, that is, injury to facial nerve results in paralysis of some muscles of the facial expression on the same side of the injury, leading to characteristic appearances in which the outer corners of the eye and the mouth droop on the affected side. Because there is loss of tonus in the orbicularis oculi, also in the corrugator supercilii, there is drooping and eversion of the lower eyelids, and it may also lead to corneal dehydration because there is no proper control over the lacrimal part of the orbicularis oculi, and at times there may also be flow of tears from the corners of the eye. And since there is paralysis of all the parts of orbicularis oculi, the patient cannot close the eye when there is harmful radiations of the sun, or when there is rain, or even when the patient wants to sleep. Well, this is the applied anatomy of orbicularis oculi. Now I would like to put down a small quiz, a question for you on orbicularis oculi. That is, the orbital part of orbicularis oculi is pierced by three major neurovascular structures, and I would love that you would answer this question in the comment section below. In case you do not know the answer, you can subscribe to my channel and hit the notification bell and ask me the question in the comment section, and I'll help you out with it. Follow my channel for more such videos and other muscles or facial expressions. I hope you find this video beneficial, and have a good day. For more such videos, please like, share, follow, and subscribe my YouTube channel. You can also follow me on Instagram. Have a good day. Thank you.